Good morning. Good morning, everyone, and welcome to this webinar on resuming international traffic and public health measures in the Caribbean, hosted by the Barbados PAHO WHO Office for Barbados and Eastern Caribbean countries. I am Dr. Rufus Ewing. I am PAHO WHO Advisor for Health Systems and Services for Barbados and Eastern Caribbean countries based in Barbados. In the first half of 2020, the COVID-19 pandemic has taken over 550,000 lives and plunged the world into the most serious human, economic, and social crisis of modern times. The situation still confronts countries across the world and the international community. Barbados and the Eastern Caribbean countries and the territories implemented international traffic-related public health and social measures early in the evolution of COVID-19 pandemic. These included border restrictions, enclosures, mandatory curfews, closures of public spaces, promotion of hand and other hygiene protocols, and the public use of masks. The Caribbean region has tourism-dependent economies has been severely affected as a result of the halting of international travel. But the public health measures have been successful in suppressing and controlling the spread of this virus to the extent that many countries are now comfortable with the relaxation of public health measures and the reopening of the borders. This webinar is planned to provide a forum for sharing experiences in providing technical guidance to personnel from governmental institutions such as health, tourism, customs, immigration, transport, and other relevant sectors, including the private and business community, to facilitate discussions and sharing of experiences with the reopening of the borders. The expected outcome of this webinar session is that there will be a common understanding of requirements for reducing the risk of importation of COVID-19 and its transmission in our communities as we reopen our economies and adjust to this new norm. At this time, I wish to recognize and welcome the presence of our invited speakers, the Honorable Malwin Joseph, Minister of Health, Wellness, and the Environment of Antigua and Barbuda, Lieutenant Colonel, the Honorable Jeffrey Bostic, Minister of Health and Wellness of Barbados, the Honorable Kerry Simmons, Minister of Tourism and International Transport of Barbados, Honorable Nicholas Steele, the Minister of Health and Social Security of Grenada, and Dr. Belmar George, the Chief Medical Officer of St. Lucia. I now invite Dr. Eteris Gibre, the PAHO WHO representative for Barbados in the Eastern Caribbean countries, to bring the welcome and opening remark for this webinar. Thank you. Dr. Gibre.
Okay, thank you very much. Honorable Ministers, Your Excellencies, Permanent Secretaries, Chief Medical Officers, UN colleagues, the UNRC, PAHO colleagues, CARFA colleagues, participants from sectoral ministries, tourism, transport, maritime, customs, immigration, and national security, the Eastern Caribbean countries, and Barbados. Good morning to you all, and it gives me a great pleasure and honor to welcome you to this webinar. I bring greetings on behalf of our Director of PAHO, Dr. Carissa Etienne. Barbados and the Eastern Caribbean countries have shown with political leadership and action backed by the community and the people's support that COVID-19 can be suppressed, no matter the stage and transmission phase in these areas. We are committed to collaborate with national governments and health authorities to remain vigilant in the face of persistent threat that COVID-19 poses during the recovery phase and beyond. The COVID-19 pandemic is a global health crisis, but it has also become much more than a health crisis. The world economy is threatened by the fallout of the pandemic. It's indeed not a question of health and/or economy. It is rather how health investment in millions today will return billions in the economy tomorrow. We are building back better for all. A decreasing trend to of no cases of COVID-19 incidence rates have been observed in most countries and territories of the Caribbean. However, in the last 3 to 4 weeks, trend lines are moving upward in few countries outside of the Caribbean, with opening of the economy despite the early decline. Some countries also experience second peaks from the first wave of COVID-19 outbreaks. These disease distribution patterns are worrisome for island nations that are tourist-dependent economies. Economic recovery in these countries depend also in the restoration of the non-essential travel linked to the reopening of borders and investing in COVID-19 sustainable prevention and suppression for the detection and management of suspected cases at points of entry. We need to succeed what we have started and control the potential transmission and spread COVID-19 during reopening of borders. The International Health Regulation Committee last May made it clear that WHO to update recommendations on travel measures and analyze their effects on international transmission of COVID-19, with considerations of the balance between benefits and unintended consequences, including entry and exit screening, education of travelers on responsible travel behavior, case finding, contact tracing, isolation, and quarantine, by incorporating evidence on the potential role of pre-symptomatic and asymptomatic transmission. Today, in this webinar, we will present some of the recommendations for consideration by member states. PAHO and WHO continue to review travel and trade measures based on regular risk assessment, transmission patterns at origin and destination, the cost-benefit analysis, evolution of the pandemic, and then use of new knowledge of COVID-19. In this webinar, we have invited experts and leaders from tourism, transport, health to share experiences and lessons learned from the country and partner experiences and WHO missions, and share the best practices they may have in updating our recommendations. We thank all of you for being here, and then I thank all of the leaders taking time and then sharing their experiences. Welcome all, and then let's start. Thank you.
Thank you, Dr. Gibre, and for that warm welcome remarks. I also now take this opportunity to recognize the presence of the Honorable Minister of Health of the Commonwealth of Dominica, Honorable Irvin McIntyre, also the Director of PAHO, Dr. Joyce and John, our United Nations Resident Coordinator, Mr. Didier Trebek, and the Head of OECS Health, Dr. Colleen Radix, and also to the other CMOs from the region within the OECS as well within the wider Caribbean region. So I will now invite to bring key remarks to us the Honorable Minister of Health, Honorable Minister of Tourism and International Transport, Honorable Kerry Simmons of Barbados. Honorable Kerry Simmons is a Barbadian attorney at law and politician. He is an appointed Minister of Tourism of International Travel and Transport. Minister Simmons was educated at Harrison's College and Barbados Community College, as well as Cave Hill campus of the University of the West Indies, and also at the Hugh Woodring Law School in Trinidad. At Cave Hill, he had also been a tutor for 2 years in the Faculty of Social Sciences. The attorney at law served as a Minister of State from 2003 to 2008 in the Ministry of Foreign Affairs and Foreign Trade, with the responsibility for Barbados hemispheric trade and economic relations, especially with Latin America and CARICOM. He was the youngest person to ever chair the COTAD group of CARICOM ministers. He was also Deputy Chairman of Barbados Joint Parliamentary Committee on Foreign Trade, Deputy Chairman of the Caribbean Broadcasting Corporation, and the Director of Barbados Investment Development Corporation. Honorable Simmons was re-elected to Barbados House of Assembly in the 21st of February 2013 general elections, and again on the 24th of May 2018 election. He is currently the appointed Minister of Tourism and International Transport in the Mayor Motley administration. Honorable Kerry is a father of one son and a coffee, and his non-political interests include scuba diving, snorkeling, and a variety of other water sports. So I will now welcome Honorable Simmons to address us here today. Thank you, Honorable Simmons.
Thank you very much, Mr. Chairman and Dr. Gabriel, colleague ministers, directors of the various health agencies represented on this webinar, chief medical officers, distinguished ladies and gentlemen all. It is a pleasure to be able to share with you today a few perspectives on the experiences that I have been, I dare say, privileged to have, to the extent that we can call the plight that put us into this set of circumstances as a privilege. And obviously to share with you a few perspectives on some ideas in the discussion phase of the reopening of our economies. Let me start by saying that I think, first of all, the point of departure should be an understanding of obviously what it really means, what it translates into when we simply say that we are talking about tourism dependent economies. For Barbados, we have a dependency which is in excess of probably 40%, maybe more like 45%, when taken both directly and indirectly, 45% of our gross domestic product, that is. Tourism obviously substantially impacts the real estate market in Barbados. It substantially impacts the insurance sector in Barbados. It substantially impacts the banking sector in Barbados, the retail sector. And obviously none of those that I just mentioned specifically are touristic in nature. So we have not yet come to the direct aspect of the tourism business, which of course is the hotel accommodation, restaurants, etc. There's also very special significance in the context of our economy, which I don't think is paralleled anywhere else in the English-speaking Eastern Caribbean. And that is with regard to the fact that we do a considerable amount of home porting business. Outside of Puerto Rico, we are really the home porting part of the English, well, of the Caribbean, if you're talking about English speaking. And it therefore means that a lot of the business that we do also involves air to sea transfers, and a substantial amount of that is ground transportation. And again, because of the fact that people have to fly into the island very often, 2-3 days, and sometimes even more in advance, in order to await their opportunity to board their vessel for departure, or alternatively on the arrival end, they sail in and then they spend a day or two in Barbados awaiting their flight out. There is also a substantial knock-on effect for short stay in the hotel accommodation of the country. Suffice it to say that the sudden and perhaps unanticipated closure of the business that I just referred to would have had a dramatic impact on Barbados's economic activity. Within a period of probably about 3 months after the closure to commercial traffic, and let me emphasize that Barbados never closed its borders. And I'll elaborate on that a little bit later, but we did maintain the borders open for a number of purposes. But coming to an end of scheduled commercial traffic, Barbados would have had to cope with a sudden and very dramatic rise in the level of unemployment in the country, which would have escalated to the region of 40% of our people being unemployed within a 3-month period. Obviously, there was also a very challenging issue for those of us in tourism, because the way in which our destination management company is structured, the Barbados Tourism Marketing Incorporated, it derives its revenue no longer from a direct claim on the public purse, as would have happened several years ago, but the business model has changed substantially, and therefore it derives its revenue from airport departure levies. And therefore, when the airport ceases business effectively, there is no departure levy, and therefore no revenue for the main driver of the tourism sector. And of course, that lends even further to the challenges that we had to confront. So together with that revenue loss and the massive furloughs, shuttering of businesses, restaurants, hotels, the ancillary services, and then a knock-on effect across, as I said to you, the indirect aspect of the economic activity, which would include farmers and ground transportation, and of course those people who are directly connected to tourism, like the land and ocean-based attractions and water sports activities and so on. We were in a very difficult situation. The reality is that this experience has to be seen not only in the context of the impact on the economy of an island, but also on the way in which our public health services are able to manage it. I'm happy to say, and I do not only say because my colleague, Colonel Bostic, is part of the panel, but I'm happy to say as a Barbadian that we all feel very proud about the way in which the public health officials of this country were able to rise to the occasion. COVID-19 positive cases in Barbados rose quite rapidly, and there were some naysayers and prophets of gloom and doom who became exceptionally perturbed when we were, in terms of the per capita ratio, we were passing 50 persons, 60 persons. We actually went as high as 97, I believe. But the reality is that we wrestled it all back down to zero. And it was an exercise in management that I think has served to help buoy the confidence of the general public, and also put us in a position where we can seriously now address the issue of reopening the economy ever so gradually, but to reopen it in a structured and sensible manner that allows for us once again to get about the business of earning a living. Obviously, the delicate balance that has to be struck is the substantial loss of revenue on one hand, the precarious state of the social well-being and the social fabric of the country, which subsequently becomes very challenged in circumstances where 40% of your population has no work. The pressure that is placed on the national insurance of Barbados was quite considerable, and rose into the vicinity of hundreds of millions of dollars in terms of claims. And therefore, that balance needed to be addressed between getting the economy going again and being able to do so in a way that was demonstrably safe and satisfactory to all those people who legitimately and quite understandably must have a prior concern about the public health considerations facing the island. So the second point I want to come to above and beyond the economy is the public administration aspect of this thing. And there are 2 points I want to make there, because one of the things that we sought to do was to try to give birth out of the challenges to some level of opportunity. The level of opportunity that we were able to give birth to was the fact that by not closing our borders, we were able to facilitate repatriation of dozens of cruise ships, members of the crew, who from all parts of the world, including places that, including cruise lines that never have been part of an itinerary that touched or concerned Barbados, they found their way here with a view to trying to get crew members who were dislocated and otherwise would not have been able to get back home, to find a way of getting them back home. And let us be very frank, this was a period of time which was exceptionally dreary and gloomy. A lot of countries around the world just simply closed the doors to cruise traffic, full stop. And so it gave us an opportunity to begin or to continue to do a level of business in an area which is very important to Barbados, while at the same time, obviously, we still had to grapple with the overarching challenges of the economic difficulties that confronted the country. The second point about not closing our borders was that we were also able to maintain connections by air and sea for the continuous importation of some of those things that we really needed to critically get into the island. And Minister Bostic, especially in terms of the health sector, would have taken command of a lot of those things, the ventilators. We actually built a hospital in quick time and then outfitted it. And all of those things were possible because of the fact that we kept both air and seaport open. The other point, though, is that it enabled our capacity building to be done in a very quiet and understated manner. And it is that very capacity building that we did during the difficult period of March, April, May, and June that now allows us to draw on those resources and that experience in July when we have started the process of reopening. And we can do so with a certain degree of confidence. So that, for example, to be specific, persons working in customs or in immigration, in national security areas, in port health, general public health, they all have had the opportunity to interface with visitors to the island. In this particular case, it would have been the crew members who were being repatriated. They all understand what it means in immigration and customs to pass these people through and to process them in a way that is safe. They all understand and have some familiarity with what is required by way of protocols in order to be able to conduct that type of business, facilitate that type of necessary movement of people, while at the same time paying homage and respect to the fundamentals of personal safety and the protocols. We would have had the experience of moving people from the seaport to the airport repeatedly in what would be a bubble type setting, and the safe movement on a number of occasions now gives confidence to those people who are asked to say, we move persons from the airport where we currently test them to an overnight facility, a hotel, where they will remain until the next day when they get their testing results coming back. So without actually having noised it abroad and trumpeted it from the rooftops, we were able to go through a process by keeping our borders open of building capacity in the country and building confidence among the stakeholders who have to be on the front line that I think has turned out to be invaluable in nature. The issue that confronted us probably by the month of end of May, start of June, was the reality that, as Prime Minister Chastanet from St. Lucia has put it so eloquently, we have to learn to coexist with COVID-19. The reality is that we cannot bury our heads in the sand. We cannot wish it away. It is a matter about which we really fundamentally have no control beyond our ability to manage the process. And therefore, until such time as there is a vaccine available, and the best advice I have on that matter is that it perhaps would have taken 18 months or would take 18 months from back in February. So there's still a lot of miles to go before we can relax. We are going to have to find a way of continuing to live while we deal with the COVID-19 reality on our doorsteps. For those of us in the Eastern Caribbean, Barbados is the case study in this particular discussion. We have little choice because there's not a lot else that is going for our economy at this stage, which will allow us to be able to make sure that we can maintain a satisfactory standard or quality of living for our people. By no stretch of the imagination is it wrong or inaccurate to say that tourism is the overwhelmingly large player in the Barbados economy. So therefore, the reopening process required us to do a number of delicate balancing acts. Again, the first of them, of course, has to be that we can't reopen without labor. And therefore, one of the first challenges that I would have had as minister would have been to sit with the members of the trade union movement in Barbados with a view to getting them to buy into the idea that not only is it necessary for us to begin to speak the language of reopening, but that we can in fact do so with a significant degree of safety. A number of meetings would have taken place and we would have worked through long hours in looking at the protocols. Our Prime Minister was very clear at the very beginning. There was a feeling at the start of this process that CARICOM could walk arm in arm and that we would go through the whole process of building out protocols and determining when we would reopen in a cohesive way and in a structured way, and that we would all wait on each other for that, that time to come. It turned out, however, that that was not the way in which it ended. And there were some who went earlier than others. And obviously that is every sovereign state's sovereign right to determine and to exercise that type of judgment. We, however, felt that it was not an issue of how early we reopen, but how safely we could reopen. And we wanted to be slaves to the science. And the science told us that there were a number of things that we had to make sure we did and make sure we got right, so as to ensure that the fundamentals of social distancing and the fundamentals of understanding, or what you had to do to protect yourself were clear to all of the stakeholders who were going to be in the tourism sector. Part of what we did, therefore, was to make sure that every hotel in Barbados has a management committee, and that management committee is charged with the responsibility now of making sure that all of the hotel workers fully understand what physical distancing is all about. They understand not only the importance of regularly washing your hands, but the correct usage of personal protective equipment. They understand the correct processes in terms of dealing with guests and so on, that the hotels are outfitted with the necessary stations to do hand sanitization and all the other things that have to be done in order to protect and promote personal hygiene. And also that the destination management company itself understands the importance of not just letting the gates fly, as it were, on the reopening process, but by doing so in a carefully selected way and on a market by market basis approach. So therefore you will recognize that we have not been in a hurry to resume flights from continental United States. And in fact, the first commercial flight from the United States will be on Sunday, a JetBlue flight coming from New York. But even then, we have determined that it must be done because of the very peculiar and I think precarious nature of that which we see happening across continental United States, that we are going to do it in a way that is manageable. So again, walking hand in hand with the Ministry of Health, who at all times have been the lead entity taking command of the entirety of the process in terms of public safety, etc. We then devised a strategy where we say, we will reopen to the United States, but we're going to pick the port of entry from which, or the port of departure rather, from which people will fly. Obviously, Barbados would have been one of those countries that benefited from the Miami gateway in a major way, and equally the Fort Lauderdale gateway in a major way. We would have seen at one stage in the latter part of the winter season, just before we closed, we would have seen traffic coming from Miami and Fort Lauderdale in North Carolina, perhaps 4 or 5 flights daily from those gateways. Right now, that is not on the cards for Barbados. And the reason why that is not on the cards for Barbados is simply because when you look, for example, at what's happening in Florida, I think it is accurate to say that there were, on some days this week, 15,000 new cases to be identified. It is just simply too great a risk. And at all stages, we've been saying that it is necessary to balance the risk with the probabilities of importing this illness. We look, on the other hand, at New York in terms of it being a gateway, which is a lot more safe. And in fact, there are no deaths recorded this week from New York from COVID-19 cases. And even though there may be 1 or 2 new cases, New York represents today a substantially different and contrasting state of affairs from that which we see, for example, in Texas or in the Carolinas or in Florida or in several other states. So therefore, one of the key approaches that we've been taking is to not just pick our markets on a market by market basis, but where the market is large enough to pick your gateways. Now, there's obviously a reality that we have to confront, because there's nothing that we can do to stop a human being from driving or finding some other mode of transportation to get from one part of the United States to the gateway that we have selected, in this case, New York, in order to bring the traffic from. But even then, we feel that it is a question of balance and risk. The next stage that we looked at was, what then do we do in order to better protect the country? And one of the requirements has been that you have to have a PCR COVID-19 test from a recognized laboratory. And we have identified recognized laboratories from England, from the United States of America, and from Canada. And those laboratories must be accredited. For example, ISOS, and I'm trying to remember the one out of the United Kingdom. It is eluding me at this point, but they must be appropriately accredited. And once our public health officials, once again, are satisfied with that accreditation, and the visitor arrives with the COVID-19 test 72 hours prior to beginning his journey to Barbados, we feel that the risk is sufficiently minimal that it is worth taking. When once you're 72 hours or more outside of a COVID-19 test, then you're going to have to be tested on arrival in Barbados. We recognize that we're in the business of hospitality, and therefore we want to make it as accommodating and as welcoming as possible. And to be frank with you, this is the challenge that is presented by COVID-19. Nobody is going to leave anywhere in the world to go on a vacation, and most of us don't enjoy the luxury of traveling for more than, let us say, 2 weeks at a time. So if we are going to go and spend a week or two somewhere, you do not expect that that week or two is going to be spent in quarantine. And therefore, if that was the proposition that we presented, we would be shooting ourselves in the foot from the very start, because nobody was going to be doing that. So we've said that, look, if you come without a test, you're going to be tested here, but you're going to be monitored. And again, we do this on a country by country assessment basis, so that we look at the markets. And again, I have had the pleasure and the privilege of working with some excellent public health officials and a colleague minister who gets it and repeatedly says that, look, this is a matter where we can say some countries represent a higher degree of risk than others. So that, for example, some of our colleagues in CARICOM really are treated identically to the way in which we treat each other on a day-by-day basis in Barbados. And we feel that it is an easy thing for them to come with a test as far as old as 7 days, because there's not a substantial degree of risk. We also feel that there are some countries which are moderate risk, for example, Canada, and there's not that high a degree of concern. But then you have some which are exceptionally concerning, Brazil, United States being among them. And for those people, there's a greater degree of attention being paid and a greater degree of care and precaution, because of the fact that that represents a level of risk that cries out for that level of specific attention. In order to facilitate the throughput of traffic, because even though this is the first week of our recommencement, we are already seeing the bookings increase. And from next weekend, we are going to be having, for example, on Saturday, 2 or 3 flights arriving within a couple hours of each other. And that means that the testing facility at our airport is going to become substantially challenged. if we do not ensure that there are external areas where we can have testing being done. So we have come to an agreement, and we are in the process of trying to flesh out any of the kinks in the system or any concerns surrounding and attendant to that agreement, so that we can have satellite stations, which would be hotels that are of the size and design that easily accommodate persons going there, being transported immediately as they've left immigration and customs. You're placed in a vehicle in a manner very similar, if not identical, to that which would have happened when we were doing the air-to-sea transfers, and you are moved to the satellite testing location where you are tested, and you're placed and you're checked into your room. You enjoy the comfort of the television, the air conditioning, the warm breeze, a welcoming fruit punch, etc. Watch some television, and you ride out the evening until when your results are available. We believe in Barbados that we can get those results back in the space of about 6 hours for most people. Depending on the density of the traffic on any particular day, that might increase, but we've given all visitors an outer window of a 24-hour period. So they spend a day in the holding hotel before they continue about their business. That is the type of approach that we have brought to bear on the system. I think that thus far, because it has really only been since last Sunday that we have started this, and like anything else, there are one or two small teething problems, but thus far, I think it is working well. And I again reiterate the fact that last Sunday, when the first flight came in, it was clear that the key stakeholders, customs, immigration, port health, and so on, were comfortable and understood what they were doing, largely because of the fact that they had had several trial runs in being able to do this type of thing when we were doing the air-to-sea transfers before. And then when some things cropped up that we never imagined, for example, the arrival of an unaccompanied minor, who would have thought in all of the plans that on your very first flight, on your very first day of reopening, that the challenge of an unaccompanied minor would present itself. It really turned out to be nothing of significance because it was handled quite smoothly. So I want to say that it has been so far so good, but part of the success story, if you will, in Barbados has been the fact that our public administration approach has been to allow public health to lead the process, because ultimately they are the decision makers in matters of this nature, and to work in a way that builds synergy with that group of professionals, so that the tourism interests are balanced against the public health interests in terms of the degree of risk. We have all left our egos at the door, and we operate in what is the best interest for the country at all times. We don't always agree on everything, but the reality is we've made it happen. And I think that that is perhaps the best that I can say to you. As we go forward, obviously, then the economic benefits start to roll in. And for any of us, the return to business is going to take a little bit of time. We are not going to be anywhere near where we were in Barbados prior to COVID for another year, perhaps, or more. And the fact of the matter is, until we get a vaccine, we're going to all have to manage this process very sensitively and carefully and selectively. So I think that the best that I can say to you is that, by way of experiences, this is not, in my judgment, an economic issue alone, nor is it just a public health issue. It is a blend of the two, and efficient public administration, which seeks to put the respective countries at the forefront of the thought process and the list of objectives and the well-being of the citizens of the country. I think that is the recipe for success. I am grateful to you.
Thank you. Well, thank you, Honorable Simmons, for that very detailed and passionate contribution there on Barbados experience. I would like to take this opportunity to also welcome Honorable Jeffrey Bostic, the Minister of Health and Wellness for Barbados. Welcome, sir, to this webinar.
Thank you very much.
Next session we will have is looking at considerations for resuming non-essential international traffic in the Caribbean and in the context of COVID-19 pandemic. These presentations will be made by two of our technical persons, Dr. Jean-Marie Rangawoba, who is the advisor for health surveillance and disease prevention and control, and also Dr. Roberta Andretti, who is advisor for international health regulations. They will make their presentations in that order. And after that, we will invite questions and answers.
Yeah, thanks, Dr. Owing, for the introduction. I think all the protocols have been established, so I'll proceed directly into the presentation. Starting with the context in which today's WebEx webinar is taking place. As we all know, COVID-19 has been in the Caribbean since March 2020. All the countries and territories in the region have reported cases, mostly linked to the international travel. And today, we are very happy to see that all the countries and territories have managed to control onward transmission. In the past 6 months, the mobility associated with the disease has remained within the country's health system capacities. And the number of new infections of SARS-CoV-2, the virus, which is responsible for COVID-19, has been declining. However, the major casualty of this global pandemic, as Minister Simmons has already alluded to, has been the tourism and hotel industry, which has endured unprecedented losses. Fortunately, as you can see on the right-hand side of the previous slide, tourism is coming back to the Caribbean. But we are still concerned about the ramifications that the reopening can have if it is not handled properly. Talking about handling the reopening of borders to tourism and other activities, WHO has already issued 6 criteria to guide the countries as they prepare for the relaxation or the lifting of public health and social measures which have been put in place to contain the spread of the virus. As you can see, number 5 of these criteria speaks to the management of the risk of importation of cases, which is the main theme for today's webinar. I assume that you are familiar with these criteria, so I will not go into the details, but suffice to say that the criteria focus on surveillance, health system strengthening, infection prevention control in high vulnerable settings and workplaces, adequate capacities to be developed at points of entry, community engagement, and risk communication. Next slide. These 6 criteria that I have just mentioned in the previous slide were not meant to replace international health regulations, which remain the main resource when dealing with health events, which can easily spread to other countries and which has a high potential for interfering with international trade and traffic. And this is the type of problem that we're facing with regard to COVID-19. The IHR document outlines key articles which specifically address the points of entry. But on this slide, I've just listed a few just for illustration purposes. But as you can see, the last 4 articles are of very great significance when it comes to the Caribbean region. And I know many national authorities who are present in this webinar will agree with me that the decisions that need to be made with regard to certain items that needs to be addressed with regard to COVID-19 in the context of reopening, these articles are very relevant. Let me go through them very, very quickly with you. Article 31, invasive medical examination shall not be required as a condition of entry. Article 32, provision of food, water, and appropriate accommodation for travelers who are quarantined, isolated, or subjected to medical examinations or other procedures should be at the expense of the state party. Article 35, no health documents other than those provided for under these regulations or any recommendations issued by WHO shall be required in international traffic. Article 40, no charge shall be made for medical examination or any supplementary examination to ascertain the health status of a traveler. Next slide, please. With regard to reopening, all the countries have been very, very busy preparing for this event. Entry requirements are being established. Some of the countries have published their protocols on the government sites, and for others, work is still in progress. We are going to hear more when the country representatives are going to take the floor and share the information on these entry requirements that they have established for their own countries. Reopening is not going to be easy, and I'm very sure the country representative will have a lot to say about it. There are some challenges which might negatively impact the implementation of these entry protocols. Here I have just highlighted a few of them for the sake of discussion, but there can be other conditions or challenges to be considered. Number one, expensive upgrading of infrastructure at the designated points of entry in the context of COVID-19 can be a big, big challenge. Limited human resource capacity to process a large number of travelers, if current practices continue being applied, will have huge logistical and operational implications with possible infringements on travelers' rights. There is a global shortage of sample collection materials, reagents, and supplies for COVID-19, which will make testing upon arrival unsustainable over time. There are uncertainties about the performance of currently available serological testing methods and interpretations, which create a false sense of security. Evolving research on the role of asymptomatic and pre-symptomatic individuals in the transmission of SARS-CoV-2 makes it impossible to completely eliminate the risk of importation. Next slide. So what would be the way forward? Of course, we have WHO criteria for adjusting public health and social measures to assess readiness for reopening. We encourage countries to continue looking into these criteria and see how far they have been coming in meeting these criteria. We also encourage countries to minimize the risk of importation of cases in accordance with IHR guidelines. And we also encourage countries to mitigate the impact of possible importation of cases. All these recommendations are summarized in the PAHO WHO guidance on consideration for resuming non-essential international traffic in the Caribbean, which my colleague Roberta will talk about in her next presentation. So I want to thank you for your listening, and I'll be ready to answer some questions in the answer question session. Thank you.
Thank you, Dr. Jean-Marie, and we'll hear from Dr. Roberta Andretti. Continue the presentation on the section.
Thank you. Good morning, honorable ministers, permanent secretaries, and colleagues. And I'll try to be as brief as possible. And I'm aware that some of you may have already listened to these considerations at the beginning of this week. Next slide, please. Okay. Now, when we are talking about resuming travel, international traffic, we are talking about something that requires an intersectoral approach, and we have heard it from the ministers earlier on. And the intersectoral approach is reflected, mirrored at the United Nations levels. In fact, there is a dedicated working group for travel and trade. And the leading agencies of this working group are the International Civil Aviation Organization, the International Maritime Organization, and the International Organization for Migration. The guiding principle for reopening borders resuming international travel are basically three. A gradual approach over time in terms of type of traffic, essential or non-essential, and in terms of geographical scope. First domestic, but most interesting, followed by international regional opening and international global opening. And in addition to the gradual principle, there is also the harmonization. And the reason for having this kind of exchanges is sort of trying to nurture and favor the sharing of a certain set of principles, of practices that would make the international traffic easier and more agile, because if there are conflicting requirements, practices that cannot coexist, then all the efforts that individual countries are trying to make are going to be nullified. And also the flexibility. This pandemic is very dynamic, changes very rapidly from week to week, month to month, sometimes from day to day. Then there should be that ability of being flexible in adjusting the reopen measures related to the reopening. Today, I might receive incoming flights from 10 countries, tomorrow from 5, and the following day I might have to stop outgoing traffic. Then these are a bit the principles. Next, please. And this working group, as Dr. Gebre alluded to in his introduction to the temporary recommendations, what this group is also recognizing is the importance of having a separate set of procedures, operational arrangements for essential traffic and non-essential traffic. And here is where what we are basically talking about today, the non-essential traffic and tourism. I would like to stress that at this stage, at least at global level, there are no talks or the very rudimentary talks regarding reopening and how to possibly reopen the traffic to cruise liners. Then if we have to formulate recommendations to you from PAHO, it would be hold on cruise liners, don't rush, because it's very unclear what such operation would entail in terms of public health and also ports operations. Next, please. Next, please. Okay, as Dr. Rangabova mentioned, as PAHO, we have developed a document with some consideration for resuming non-essential international traffic in the Caribbean upon request of the country offices, and this document might have already been shared with the national authorities. What I would like to stress, as an overall framework, is that at this stage of the pandemic, and with the tools, diagnostic and therapeutic tools that we have available, there is not such a thing as zero risk of importation. There are going to be importations, yes or yes, the moment the borders reopen. Then, and as the Minister of Tourism of Barbados mentioned, it's very important that all the consideration for reopening are made in a gradual manner and based on a risk assessment, and it was alluded to the epidemiological situation in the countries of origin of the flights. Next, please. this is probably one of the most important messages that I would like to share with you. And when we developed that document, we made a number of assumptions before we formulate some considerations. And the assumptions are that across the globe, there should be no country that is allowing known cases of COVID-19 and known contacts to undertake international travel. There should be this first filter. This should not happen. And because we assume that no known cases or laboratory confirmed cases and non-contacts are going to be allowed to travel internationally, then the corollary is that international travelers should not be regarded and treated as contact. And I think Barbados has already metabolized the message. It doesn't make sense reopening and then putting people in quarantine. Travelers should be subject to a different regime, but yes, a regime of follow-up. Then the other assumption that we are making is, yes, also individuals who are unwell are not going to undertake international travel. And most important, we are also assuming that countries are, before establishing protocols related to the incoming travelers, they are thinking 2, 3, 4 times about the rational use of resources, in particular the laboratory diagnostic, thinking also at the sustainability, because now you might be dealing with 2 flights per day, but if the situation improve, you might aspiring at being more inclusive, at increasing the frequency of the flights, and you might not be able to sustain. Also because of what Jean-Marie said about the market situation for accessing those the laboratory diagnostic tools. Next slide, please. And then I've heard in different fora about certain practices that seems to be fairly rooted into the approach for reopening, but also for managing acute public health events. And then I would like to take this opportunity to also draw your attention and alert you that there are certain practices that are giving a false sense of security. And they also require substantial resources and then to the extent possible, avoiding if your protocols for reopening the traffic, in your protocol, avoid to embark into actions that are very cumbersome and with a really limited return. And the practices I'm referring to is the body temperature screening, also the laboratory testing, because of the dynamic of the infection of SARS-CoV-2 virus. Certainly, there is a sort of global consensus that it doesn't make sense to require a laboratory test prior to departure, because there are huge operational implications, but also because by requiring a laboratory test as the certification of a laboratory test as a condition, you are also contravening the Article 36 of the IHR. And the other caveat is we are also concerned about the testing upon arrival because of the operational implications, and because not necessarily a test, a negative test upon arrival would be a guarantee of that the person is not infected. And people want to arrive in the country and they want to be able to go about their business. We are also concerned about requesting a declaration, filling forms, declarations, health declaration and questionnaire, because first, because travelers want to enjoy his travel, want to move forward. And also there is the issue of forming queues at the lines at the airports, or and there is also the information management that is of concern. Then to the extent possible, the only thing that is really needed for public health authorities is being able to locate the travelers throughout the stay in their territory. Next. And the last, I'd like to alert you, and the last caveat is that according to Article 40 of the IHR, a country cannot charge the travelers for the application of measures for the protection of public health. Travelers cannot be charged for quarantine, for laboratory tests. This is a responsibility, financial responsibility of the country. There should be no transaction between the individual traveler and the authorities. Then, of course, there are other channels for national authority to try to recover those costs. But according to the HR, the traveler should not pay any out-of-pocket money. Next, please. Okay, and we have heard, I think that in terms of approach, the key factors to decide on how, from where to resume international travel, incoming travels, and in a gradual manner. I think that the Minister of Barbados presented it very clearly. First of all, the country of destination has to have the capacity to handle importation, because it's almost there are going to be importation. Two, the country, to mitigate the risk of importation, can select the origin of the flights of the travelers. And then there should be also the capacity to communicate the reasons, the rationale of this arrangement to a number of diverse audiences. Next, please. Now, it's a bit busy, this slide, and I do apologize. But regarding the public health capacity in country, I think we need to think in terms of protocols for managing incoming travelers. And as I mentioned before, we are not really recommending for introducing testing requirements and the completion of health declarations of those kind of forms. The only very strong recommendation is having the ability to locate the traveler during the stay in the country. And there are a number of options to do it. And the second key capacity that we are really recommending is defining the modalities to monitor the health status of the traveler for 14 days, up to 14 days while on the territory, or up until, if the traveler leaves earlier, then goodbye. And the monitoring of the health status can take different shapes. There can be different operational arrangements. This can be done through applications. It can be done by telephone. It can be done through arrangement with the hospitality industry, with hotels. But these are really the two key points: be able to locate the travelers and to monitor the health status up to 14 days. Next, please. And regarding how to reduce, what consideration to reduce the probability of importation, and the Barbados explained very well. We look at the epidemiological situation in the country of origin, and the first consideration that we should make when looking at the probability of importation is the type of transmission scenario in the country of origin. And according to the WHO classification, which includes 5 categories, the scenario, let's say, which entails the highest risk of importation is from countries experiencing community transmission. Next, please. And if we look at the countries, if, as in the case of the Caribbean, you are looking at resuming, and you are already doing it, resuming incoming travel from countries experiencing community transmission, like the US, and deciding on, and then when looking at the situation more in depth, at the situation in countries experiencing community transmission, there are a number of factors that we should be look at. First, epidemiological indicators that are available on the WHO website, headquarters, PAHO, and other regional offices. And epidemiological indicators are, for instance, the trends of new cases reported daily, the trends of the 7 days rolling averages, and the trend and the value of the effective reproductive number. Then, as Barbados did, because especially in larger countries, the epidemiological situation might be very diverse, might be a mosaic, then there might be a need to consult specific websites run by national authorities, local authorities, and also in some cases to establish bilateral consultation to have a better sense of whether from a large country travels from all the places of departure can be let in, or there should be a selective approach. Next, please. And the last set of comments is regarding the communication. As I said at the beginning, we are going to be an exercise that requires a lot of flexibility, is going to be very dynamic. Therefore, in defining your the incoming traffic or your approach to reopening the borders, these require a very systematic risk assessment approach, let's say every 2 weeks, because the situation changes rapidly. And it might also happen that you might have to close your border to outgoing traffic because the situation degenerates within your country. And there should be a communication mechanism that are agreed upon by all governmental sector and targeting different audiences, diplomatic channels, tour operators, airlines, the general public. And the communication about the measure should be obviously very clearly and timely. But I would also like to stress the communication should be made through channels that are used consistently. The user should know, the public should know that I know that on this website I can find this information, not having to do fishing expeditions. And of course, there is the need to engage the public, the travelers, and other stakeholders in all this process. I think that's all I have. Thank you.
Thank you very much, Dr. Andretti. Okay, so we now have a question and answer session, but I am inviting questions only related to the last 2 technical presentations. If anyone have questions specific for Honorable Simmons from his presentation, you can ask those questions now. But also bear in mind that we have 4 country presentations coming up next, which are health related. And all of the questions that have been asked thus far are related to country-specific health questions. And I will defer those questions to the end of the next session, where they might have been answered by the speakers during the session or could be answered after the session. Okay, so if there are any questions for the last two speakers, I invite those questions now, but I don't see any in the chat.
Yes, Carvin from actually BVI. I just need to say that I'm pleased to join the team, and thank you very much for the information shared. BVI, as you're aware, being further up north, we have the challenges of, all around us being as active as it is. So your input has been great, and we thank you very much.
Thank you very much, Honorable Malone, and welcome to this webinar. And please continue to tune in. And if you have any specific questions, you can continue to ask your questions. But welcome to the session, Honorable Malone. Thank you.
Good.
Okay, there being no further questions, I will now move on to the next session, where we will have a panel of presentation from 4 countries, 3 ministers of health and 1 chief medical officer. To all of our speakers, and I will now invite the Honorable Malvin Joseph, of Minister of Health of Antigua and Barbuda, to make his presentation. Thank you.
Thank you very much. Let me say how delighted I am to join my colleagues and ask you, Mr. Chair, to allow me to adopt the protocol already established, and to say it's my delight to share the experience, Antigua and Barbuda's experience, having been the first Caribbean island to open up its borders or reopen its borders. I listened intently to Minister Simmons, and I really appreciate the comprehensive presentation he made. And one of the things that stuck in my mind is the fact that he indicated that Barbados's economy is approximately 45% dependent on tourism. And I then realized the challenge of Antigua and Barbuda, since Antigua and Barbuda's economy is 90% dependent on tourism. So you can appreciate the importance of the country opening up for its only, which is literally its only industry, tourism today. Now I want to indicate from the onset that many things had to be in place before we open our borders. And one aspect of it that should not be understated or underappreciated is the fact that when you open your borders under these circumstances, you need to understand the importance of having the entire country supporting this decision. To fight COVID, you must fight COVID on a platform of confidence, and confidence embraced by the wider society. We consulted widely, and we got the support from the private sector, tourism, all the other sectors involved, banking. We also, the ecumenical sector. We had a tremendous support across the board for the opening of our borders. Of course, it was influenced by the reality that without tourism, Antigua could be plunged in economic danger. And so that was one of the important steps. Then we had to make sure that we had all the necessary protocols well developed, well thought out, that were established already through the assistance of PAHO and CAFO primarily. All those documented protocols were considered pivotal in our decision to open our borders. Further, we had to ensure that our infrastructure was in place and had the capacity to deal with any number of cases. And I think the point was made earlier that one can expect to see some clusters of cases from time to time when you open your when one opens its border. Now, we made a decision in Antigua and Barbuda that in terms of the status of COVID, we had to be in a position where there were few or no active cases at the time of opening our borders. When our date was scheduled, which was the 1st of June, we had no active cases at that particular time. But soon thereafter, there was a single case. And we decided to forge ahead with that single case because we are confident that it could be well managed, which it was. Additionally, we thought it necessary to develop an independent facility away from our general hospital to handle COVID cases. And so we completed the Infectious Disease Control Center here in Antigua and Barbuda, where that center is equipped with the most up-to-date equipment and trained personnel away from the hospital in order to deal with severe COVID cases. When I talk about severe COVID cases, we are talking about people with pneumonia and respiratory, other respiratory symptoms. So as it is in Antigua and Barbuda, our COVID cases are not in any way handled or connected with the hospital. And then, of course, we had to ensure that we had an understanding with the hotel industry on their role in managing COVID. All these things were put in place. So on the 1st of June, having opened our borders, we had our first flight on the 4th. 3 weeks within our experience of opening our borders, we had already received approximately 4,000 visitors. I'm sorry, that 3 weeks, not 3 weeks, the first 7 weeks of opening our borders, I'm sorry, we received approximately 4,000 visitors. But 3 weeks within our experience, we had an unusual situation where we had 42 of our citizens in Dominican Republic for some 2 months. And we had deferred their return to Antigua and Barbuda until we were satisfied that we had no active cases. During the same time, when we decided that they would return around the 25th of June, we also had flights coming in the evenings on American Airlines. And on the 19th and the 20th of June, when those citizens returned from Dominican Republic, and on the 2 flights on the 19th and 20th of June, the testing of the individuals coming on the flight revealed that 19 of the 42 citizens coming out of the Dominican Republic were tested positive. And on the 19th and 20th of June, on 2 flights coming in to Antigua and Barbuda, 20 individuals were tested positive. These 2 clusters created quite a stir in Antigua and Barbuda and elsewhere, and questioned whether or not we had opened our borders too soon. Let me deal with the 42 passengers coming out of the Dominican Republic. We had anticipated that we were going to see positive cases, and they all were placed in quarantine. That decision was made ahead of time. The decision also in terms of the 20 passengers who were tested positive coming on American Airlines, they too in the hotels were placed in isolation. They have since returned to the United States. The point I wish to make here is that if you were to look at the numbers in terms of visitors to Antigua and Barbuda, Of 4,000 individuals coming to Antigua and Barbuda, there were only 20 positive cases. And those cases were before we instituted the requirement for PCR tests upon arrival. So the first phase of our opening did not require PCR tests. It is now. The point that I believe is important for my colleagues who will eventually is that the reality is that as long as you open your borders, you're going to have cases. And I appreciate the comment that one can expect the sporadic case or the sporadic clusters. This will happen. What we need to determine, though, is whether or not the capacity is in place to manage this risk. In the case of Antigua and Barbuda, as a result of where we are as of today, all the cases that we experienced during this time were managed. There's no evidence of community spread. There was a single case incident of transfer from imported cases, and that is in one hotel where they failed to observe the protocols that were established. And this is a lesson for all of us. I believe that the government will most likely fulfill its obligation to ensure that the protocols are followed in the strictest of terms, but we must also get our private sector partners to appreciate they have an equal responsibility to ensure that these protocols are followed. We have since in Antigua and Barbuda strengthened the surveillance at the hotels, demanding enforcement of these protocols, and we have seen experienced a positive response. Now, if you arrive in Antigua and Barbuda, before you take step to any other processing, you must go through the health screening. We do not believe that the health screening should take place beyond immigration and customs. And this is why our procedure requires that all visitors come in. The first point of contact with any individual in Antigua and Barbuda is with health officials. That has worked extremely well for us. We have the requirement for a temperature check, which works well as a preliminary surveillance mechanism. But we also have a declaration that should be made by, a health declaration that should be made by everyone, given their most recent health history. And of course, as I mentioned before, a requirement that all visitors coming to Antigua and Barbuda must have the PCR test within the 7-day period upon arrival, within 7 days. Now, I do not wish to be too long because I think the essence of this to share experience is really to get my colleagues to ask any questions that based on the experience of Antigua and Barbuda. The situation is now that we are anticipating more flights in Antigua and Barbuda. We have the infrastructure in place. We're even creating additional facilities. We have another small hospital that should be open within the next 60 to 90 days to accommodate cases other than the routine cases at Mount St. John Medical Center, our main hospital. And that is additional capacity if we need that capacity to handle COVID cases in Antigua. At the end of it all, it comes down to balancing the risk. At no time did Antigua and Barbuda consider risking the health of its people, but rather we engage in a risk management methodology to keep a balance in reopening our economy and at the same time guaranteeing protecting the health of the people of Antigua and Barbuda. So Chair, that is my presentation at this point, and I await the reaction from my colleagues at the appropriate time.
Thank you, Honorable. Very insightful presentation. We will have some questions. I'm sure there'll be some questions for you at the end of the session. I'll now invite Honorable Jeffrey Bostick to make his presentation on behalf of Barbados.
Thank you very much. Thank you, Brother Marvin, for your presentation. I'm going to change my presentation a bit because my honorable colleague, Tourism Minister, would have touched on a number of areas that I would normally have touched on. So I want to focus on some experiences that we have gained as a result of the reopening and since the reopening, and I will share those with you because I think that they may be useful to you. But I start by saying first and foremost that what we are facing at this point in time, having resumed international traffic, is far greater than what we faced when we started this initial journey before we had our first case. But what is even more important in my view is that we have a lot more resources and greater capacity now to deal with what is coming than what we had when we first started. And one of the most important aspects of that for me is the experience of having dealt with 92 cases prior to this and all that entails. We now have some experience when it comes to almost everything, which we think would be to the advantage of the country and to the advantage of the region if we operate in a collective and cooperative manner. I will start first of all by dealing with tests and testing, because obviously this is a criteria for most countries for persons coming in the resumption of international flights. We've had a situation where a large number of persons are actually arriving with the valid COVID tests and within the stipulated 72-hour period, but we've had some tests that we've had to reject. We've also found that in a repatriation flight, that 2 persons who came with negative tests, when we tested them at the airport on arrival, they were positive, and that was another interesting experience. We have been doing something which the Prime Minister has insisted on, which is at the moment we are holding persons at the airport or at a satellite hotel that is also doing some testing, and people are being kept until results have been returned saying that you are negative. Those are for persons who are tested on arrival, and that has helped us in terms of being able to contain or to eliminate any spread into the general community and general population. We encountered a problem with in-transit passengers, and we had to change the protocols 1 or 2 times in relation to those, and I'll share that with you, because in transit is about a 24-hour period here in Barbados, but because of the configuration of our airport, in transit passengers, several of them have to actually go outside of the airport in a lot of cases, and then to book again. And then we have persons who may be here for a long period in transit, like an 8-hour period, that may decide to go to town and come back. So we have insisted that all persons in transiting must come to Barbados with a valid COVID-19 PCR test. And this is important for us. And this is even so for persons who are just in transiting for maybe an hour or whatever to get a connecting flight. And the reason we've decided on doing that is at least if the test comes back positive, even though the person may not be here, at least we would know that the person tested positive, and it gives us a chance to do some tracing of some sort. And also it gives us the opportunity to forward that information to the ongoing countries so that countries who are receiving these persons are aware. So for us, that is important, and we hope that that can be a reciprocal arrangement between our countries. We had another very interesting experience where we had a repatriation flight, the last one from the United States, and one person would have tested positive on arrival. But we have created a situation where we allow persons to be tested on day 7, given the incubation period. And we've been doing that. And on day 7, when we tested those persons who all tested negative except for one, 4 persons then tested positive. And these are persons that would have tested negative on arrival. As a result of that, and doing the contact tracing all over again, even with the aircraft and the seating arrangements on the aircraft, out of the, I think it's perhaps about 60 or 80 persons who would have tested negative and would have been in quarantine at home, 32 of those persons actually sat close to some of these 4 persons who would have tested negative on the second test. And we delayed their quarantine. We kept them in quarantine for an additional period of time and tested at day 10. And on day 10, those 32 persons who were retained in quarantine, 3rd test, 1 more person tested positive from that batch. So I think that that is very interesting, and I thought I would share it with you because that would give you some food for thought. We've also been having some issues in relation, and we had one major issue with diplomats. And how do we treat the diplomats? And especially diplomats who do not want to play ball and who want to cite diplomatic immunity and who may not come with a test, a valid test, and then who refuse to take a test locally. This is a situation that we face. I believe in the end we got it resolved, but this is, I'm just alerting my colleagues to this situation because it can happen to you as well. What I would also say is that from our experience, all of the cases that have been imported since reopening, and that is for the most part, I'm talking really about the repatriation that we've had, all of those confirmed cases have been asymptomatic. And that is also worthy of note because obviously this is something that we really have to watch going forward. I also believe, coming out of our experience, that the importance of communication and collaboration between our countries in terms of keeping each other abreast of what is happening and forwarding information as people transit our airports, and sharing this information on a regular basis as to how we are doing and the obstacles that we found and the situations that we really would not have planned for or even thought about, as Minister Simmons said, in terms of the unaccompanied minor. Those are things that I think that we need to keep sharing with each other as we go on. And the final thing that I would say here, and I think this is in connection with the last point of cooperating and collaborating. When we started this journey, all of us, we were short of everything, from swabs to kits, everything. But I was happy, and I'm happy to say, and I thank my colleague, Minister from Dominica and his team for coming to our rescue here in Barbados when we were short of swabs, that we were able to get some from Dominica. And then when we had enough, we were able to help Antigua and Barbuda. And for me, this is the way we have to be going forward if we are to fight this thing, because all of us depend on tourism or people coming in and out of our countries. The risks are there, but we can manage the risks if we do so collectively and cooperatively. Thank you. Over.
Thank you very much, Honorable Bostic, for that very passionate and useful presentation based on actual experience, and I think and how you managed to solve those challenges. I'm sure that will be very instrumental to many of our other countries. Okay, I will now ask the Honorable Nicholas Steele from Grenada to make his country presentation. Honorable Steele.
Well, good afternoon to you, and good afternoon to all who are online. Thank you for the opportunity to discuss some of the challenges and issues and protocols with respect to reopening. In Grenada, we took similar routes to our neighboring countries, save and except that we are yet to open officially to commercial flights. We opened to commercial flights within the region, that is our CARICOM region, on the 15th, but as yet there hasn't been any of those commercial flights. Our policy started first and foremost with making sure, like I think most other countries have, to strengthen our local capacity on island to deal with COVID-19. Prior to and during the epidemic up until June, a total of 25 persons were involved in contact tracing, those who were public health officers and district ministers, etc. We would increase that number to 100, with the persons trained to do contact tracing. Rationale being that if we are going to reopen to business, we need to, when we previously would isolate individuals within a 24-hour period, complete the contact tracing. We wanted contact tracing to be completed as best as possible within 6 hours. So we've significantly increased those numbers. We also wanted to make sure that we had, despite the challenges, 3 months worth of supply, testing supplies on island. And then we would keep replenishing, but we keep that buffer of 3 months of testing supplies, that's rapid tests. So we estimate 5,000 rapid tests per month. We have 15,000 rapid tests on island now, and are ordering between 5,000 and 8,000 every month afterwards to top up that. We also increased our testing facilities PCR-wise. We have 2 testing facilities on island. We're working in cooperation with St. George's University and our national lab. Our total capacity now, ability to do 300 PCR tests per day. That is in the odd occasion that an entire flight needs to be tested immediately because of infection. So a worst case scenario. Training and protocols within the hospitality has continued, certification, and now we are into our monitoring and enforcement stage. 100 contact tracers are also health wardens and are responsible for monitoring and visiting all of the tourism sites, all sites in general, to enforce the protocols, and have been deputized by the public health officers that they can issue tickets, so to speak. Our biggest problem right now in contemplating opening, well, let me first start that we go back to, we have ranked regions or countries. We are using a system adopted by the European Union Center for Disease Control because they are doing regular updates. And that is a traffic light ranking of countries. Green, yellow, red, or low, medium, high. And the ranking that we use, the number of cases new cases in the last 14 days per 100,000 population. So 19 or less new cases in the last 14 days per 100,000 population places a country into the green or low risk zone for us. Between 20 and 60 new cases in the last 14 days per 100,000 population places in the yellow zone, and 60 and above places in the red zone. Green zone countries, to date, our protocol, which is going to be reevaluated today, our protocol is that you will only be required to take a rapid test on arrival in Grenada. Once you test negative on that rapid test, you are free to roam, like Grenadian citizens do here under our social distancing protocols. Yellow zone persons arriving into Grenada, which right now would be Canada, the UK, and most of Europe, must have a PCR test before boarding a flight. So before leaving to come to Grenada, and it must be within 7 days of that departure. On arrival in Grenada, within 48 hours, you will receive another PCR test. Waiting for that result, you are in state-approved quarantine facility. After that result, if it is negative, then you are allowed to enter our tourism bubble, as we refer to it, or if your accommodations, other accommodations are pre-approved there is an application process as well. If they are pre-approved, we will be allowed to go to those accommodations, but we will be asked to wear the GPS wristband. We can monitor your movements. High-risk countries or red zone countries equally need a PCR test before departure to Grenada. On arrival, will also receive a PCR test within 48 hours, but will remain in a state-approved quarantine facility for the duration of their quarantine, which is, we have stated at 14 days, but we give the discretion to the Chief Medical Officer and public health authorities to reduce that to the 10 or 7, as is being prescribed now by PAHO and WHO and PAHO. The biggest challenge is that our main gateway port, the United States, gets worse and worse every day or every week. And therefore, where one would assume that in opening up, you monitor and you can contemplate a loosening of system or maintenance of a status quo, the US, the figures that we are seeing and they are increasing, forces us to keep re-evaluating. To where we said we would open to commercial traffic to the US on the 1st of August, we are now giving that serious consideration and pushing that back to the 1st of September, subject to continuous monitoring of the situation there. But there will not be commercial flights from the United States before the 1st of September. That is being pushed back. To date, the other biggest challenge is that which is referred to as the shedding of the virus. I think that is what Minister Bostic also referred to as well. Of individuals entering, in particular, we've had this first showed up with individuals returning from cruise ships that would test positive on arrival. And then within 24 hours, if we did another test, it would be negative. And then another 24 hours, the test will be positive again. And this phenomenon is explained by WHO, PAHO, and PAHO as shedding, in that the PCR test is picking up the dead virus and not the actual virus, and that they are not infectious. But it is difficult now from a port screening process, where we say within the first 48 hours it will be PCR tested there. If that PCR test comes up positive, then we are to immediately treat that individual as a positive case. So the challenge now is that previously during the pandemic, one positive case meant that you were positive, and you needed 2 negative cases in 24 hours to confirm that you are negative. Now it is begging the question with respect to shedding. You need 2 positive cases in a row to determine that somebody is positive because of the phenomenon of shedding. Or should you just take the precaution, if someone shows up positive, then you keep them in quarantine for 7 days before you do a test, and just err on the side of caution. That has hit home as of yesterday in terms of Trinidadians who are living in Grenada, the repatriation flight from Grenada to Trinidad yesterday. While we have had no positive cases on island in the last 4 weeks, 3 of those individuals that were on that flight from Grenada to Trinidad tested positive PCR on arrival in Trinidad. The CMO in Trinidad has confirmed in conversations to me and my CMO that it was a very low viral load, and in his estimation or his opinion, it is an occurrence of shedding. But from a Trinidad standpoint, those individuals will remain in quarantine for their required 7 days before they're tested again at the end of that period. I have since asked the CMO in Trinidad to test them before that, within the next 24 or 36 hours, so that we can ascertain as to whether it is an occurrence of shedding or not. Because to add to that, 2 of those individuals are male who travel with their wives and have been in Grenada with their wives for the past 3 months, but the wives tested negative on arrival in Trinidad. And that would be the common occurrence we are seeing with shedding, that the wife would test positive and the husband not in 24 hours. That is one of our biggest challenges with respect to port screening, with respect to keeping our borders safe, with respect to saying that people are going to stay in hotels. How do we ascertain whether it is an occurrence of shedding or whether it's a true positive case. Because if it is a true positive case, time is of the essence. And one should start contact tracing if that person has interacted on a flight, should start contact tracing immediately. But if we are going to be cautious and say that we want to determine whether it is shedding or not before we overreact or react as we should, then we lose another 12 to 24 hours in terms of testing again. In terms of reacting to isolate people who are in the same city and we are interacting with individuals. That is posing a challenge. I mean, in terms of what is the real answer or true answer, it is difficult to do. The other part that is also difficult is being able to say that we want individuals from the US or elsewhere to have PCR tests, certified PCR tests. How do we ascertain with our limited resources in our missions abroad that labs are certified? What criteria do we use? And how do we verify? And how do we verify in the short period of somebody uploading their test results to us, and for us to find a way to validate the certification of that lab? That again is a challenge moving forward that we need to deal with as a region, I think, to find a solution that works for us all. And finally, the policy that I think needs to be adopted based on what happened in Trinidad with our Grenadian, Trinidadians returning from Grenada, is that, and I think Barbados has put it in place as well, or made an announcement yesterday, everyone coming to Grenada, quite likely will be PCR tested on arrival. While we respect the CARICOM integrity that we have in terms of common testing, etc., but I think we need to look at everyone coming into our country having a PCR test, and also for the safety of those traveling to, particularly our neighboring countries. But I do believe that as governments, we should facilitate that everyone leaving should have a PCR test prior to departure. If someone is leaving Grenada to go to Barbados, I think I owe it to my associate, my brother in Barbados, and the fellow citizens of Barbados, for us to set that criteria that they will take a test here and must be PCR negative before they can travel from Grenada to Barbados. Wherever else they're traveling, and vice versa, for a Barbadian or somebody in Barbados coming to Grenada. That helps us to tell the occurrences of shedding. As if we will trust Barbados testing, and Barbados will trust our testing, because we are national labs or certified labs, then a CARPA certified lab. Then if someone tests negative in Grenada and 24 hours or 36 hours afterwards tests positive in Barbados, it allows my brother in Barbados to contemplate whether it's shedding or not, and to deal with it accordingly. So I think that is what we need to consider and discuss as ministers moving forward, apart from the fact that we continue to observe the occurrences in Barbados and in Antigua, and are fortunate that our associates are sharing information, and that we are adjusting as they adjust, because there is no roadmap in this. There is no book that we can follow, and we are learning as we go along. But I think what is essential is the sharing of information and the adopting of best practices, which can only happen with the sharing of information and through frank discussion. We need to be our brother's keepers, and I see Minister Bostic nodding, and I think we can come to an agreement on a mutual testing of individuals traveling back and forth. It will be an inconvenience for the traveler, an added inconvenience, but it is far less of an inconvenience than having community spread in our islands, or then knowing that somebody got on the flight that was positive between the islands. Thank you. I look forward to any questions of the operator.
Thank you very much, Minister Steele, for that experience-based presentation. I'm sure that other countries would benefit from. We'll have lots of questions for you as well, or should. So I will now ask the Chief Medical Officer of St. Lucia, Dr. Abelma George, to make the presentation on behalf of St. Lucia. You know, St. Lucia was a country that is charged with to lead the Caribbean opening of borders. And so I'm sure they have lots to share with us with regards to the reopening. Dr. Balma George?
Good morning, thank you. I'm going to make a presentation, so I will share. Good morning to all. I would like to adopt the protocol already established. I'd like to also apologize for the absence of our Minister of Health, who's unavailable at this time. I'm here with the Permanent Secretary, Ms. Donnellan Vite from the Ministry of Tourism. She's also going to support in the presentation that we are going to give this morning. We'll start off with a situation analysis for our health situation in St. Lucia. We'll give a summary of the national strategic approach to moving forward, regulating tourism today to reduce the risks for tomorrow, and moving forward as a resilient state in the new normal. This is just a pic of our dashboard to give an indication of where we are today with our cases. We have a total of 23 confirmed cases in St. Lucia. We've had no deaths. Presently, due to the opening, we've formally opened last Thursday, which was the 9th of July. And as a result, we have 845 persons in quarantine. In preparation for the tourism sector, one of the things that we knew we needed to ensure was in place was the strengthening of our health system. Given, as indicated by the ministers earlier, we anticipate increased number of cases. So the country has to have the capacity to be able to manage.
I would like to recognize the presence in the room of the Chief Medical Officer for Antigua and Barbuda, Dr. Rhonda Seeley Thomas, as well as Chief Medical Officer for British Virgin Islands, Dr. Irad Potter, and actually just joining us now is the Premier from the Turks and Caicos Islands, Honorable Charlene Cuthbert Robinson. Honorable Robinson, welcome. You've missed most of the ministerial presentations, but I'm sure you will benefit from the various questions and answers towards the end of this section. So welcome, Honorable Cartwright. And also the Chief Medical Officer from Barbados, Dr. Kenneth George. I saw his name earlier.
Okay, I've sent it. So if she could just share it when she has it.
Okay, if you, well, what I will do then in the interim, because since that is a very important part of your presentation and you may not, we want to use that as a guide, what I'll do, there's a few questions that were asked already, and I will pose those questions to be answered very quickly by the relevant person. So there's a question related to Barbados, so that given that persons can test negative at one point, but then test positive later, will visitors be checked daily for 14 days? And what are your plans to treat possible incidents of visitors testing positive but refusing to go to treatment and isolation protocols? So I think that's for Minister Bostic. I think you mentioned some of that earlier as well. Minister Bostic.
Yes, thank you. First of all, in terms of the isolation of visitors, if visitors test positive on arrival, it is mandatory isolation, and that has been included in the protocol, so they know that when they're coming here, that is the situation, and that isolation could be at a government institution, which we have established at Harrison Point, and we're also working to have a couple hotels that will facilitate the isolation of visitors who are asymptomatic. And that would be sanctioned by the Ministry of Health and Wellness. So isolation is in order there. As far as visitors, generally speaking, even though you may come in with a negative test, you are subject to monitoring. If you come from a medium risk or low risk country, if you come from a CARICOM country, for example, you're not in any form of quarantine, but you can expect that from time to time you will get a call to see how you're doing. So that is in place for all visitors. And those who are actually in quarantine, or those who have to stay in the hotel for 7 days or whatever, depending on the region they're coming from, then they're checked either passively or actual visits at least twice a day.
Okay, thank you very much, Minister Bostic. There were two other questions here. Also, they were for Minister Carrie Simmons, Honorable Simmons. And this question is related to, this is someone from Johns Hopkins University, a Barbadian born at Johns Hopkins University, asked about what is the current status of cruise ships in the Caribbean and what will the future look like for this type of travel? And the second question for Honorable Simmons was JetBlue canceling its flight. What can be done, what the country can do to help stranded passengers? And those are the two questions directed at Honorable Simmons.
Perhaps I should, perhaps I should begin with the latter. I am not aware of where this story about JetBlue canceling its flight has come from. I was just being made to understand that it is subject of discussion on our regular call-in program or daily midday call-in program on one of the radio stations in Barbados. But to the best of my knowledge, information, and belief, the challenge with JetBlue is just a question of it being the flight no longer being listed as it is full, both in and out of Barbados. But I am not aware of any cancellation of that flight, which is scheduled to come in next Sunday. With regard to the question of the cruise ships, cruising is still embargoed by the international governing body for international cruise, commercial cruises. And that situation probably is not likely to be lifted until sometime into the winter season. We stand prepared and ready once it is recommencing to be party to that approach. I have said domestically and in a couple of these types of regional exercises that I think that for us in the Southern Caribbean, it presents a very interesting opportunity and in many ways unprecedented. When I did my presentation, I made reference to trying to milk opportunity out of the crisis. The opportunity that I see for us in terms of cruise is that Barbados, because it has gone above and beyond the call of duty in order to extend exceptional degrees and demonstrations of goodwill, has built some relationships with the international cruise sector that are fairly valuable, we think. And what we really should be doing in this region, and I'm happy to say I've begun to have a few conversations with my colleague in Grenada, my colleague in Tobago, and one or two of the others, Curacao, Aruba, along the lines of us trying to put together a Southern Caribbean cruise itinerary, which I think will allow us during summertime, when we traditionally have a steep fall off of traffic, to be able to reposition ourselves and bring a level of competition to that part of Europe where people traditionally go by way of cruise in summer. We are more in the Caribbean than just a warm weather destination. I think we have a lot of potential in terms of heritage experiences, cultural experiences, especially during summertime when we have a lot of our festivals and so on going on, and that we could do a lot of good and useful business. If now that the cruise ships have seen a side of the Caribbean that they never had an opportunity to see before in terms of the way we manage certain key issues like this public health crisis, the way in which we manage issues relating to administration of challenges that the industrial world was not able to adequately manage and that type of thing, then perhaps it is the opportunity now to extend a hand of partnership. And that is the discussion that we've been having with the international cruise community. And I'm hoping that it will bear fruit. So preliminary discussions have begun. They seem to be optimistic at this stage, and one has to just wait, watch, hope, and pray.
All right, thank you for that answer. Right, while we're still waiting the projections for Dr. Belmont George's presentation, We have one other question, Honorable Bostic. I know you opened a very important subject earlier concerning the diplomats, and persons are out there asking, how did you resolve that that particular dilemma? If you're willing to share.
Yes, I can share. I can say to you that we felt very strongly that we had the right to refuse entry based on the fact that COVID-19 for us is a national security situation, and national security trumps anything else. And persons were adamant, and we were even more adamant.
Yes.
So the matter was resolved because whatever testing that was required actually in the end took place.
Okay.
But I raised it because it could happen to any other country represented here.
Yeah. Okay. I don't see any more questions in the chat here. But while we make the presentation, I know that both Minister Bostic spoke to. Okay, there is it. Okay. We'll save that last question towards the end. Dr. Belma George, you're up again. Continue, please. Thank you. And thank you for your patience, participants.
Thank you very much. Apologies, I'm not sure what happened there. Okay, like I indicated earlier, we look at the situation analysis for St. Lucia, a summary of the national strategic approach that we took to moving forward in relation to the opening of the borders, and also the regulation that we put in place for tourism to reduce the risks moving forward, and how we move forward as a resilient state in the new normal. We look at the situation analysis. You can go ahead. This just gives a snapshot of our dashboard in terms of the number of cases. We've had 23 confirmed cases to date. We have increased numbers in quarantine based on the opening of our borders from last week. So far, we've had no critical cases and we've had no deaths. You can go ahead. This just gives an idea of the strengthening of our health systems as we move to the increased risks of opening the border and tourism. As a result, we had to ensure that the country has the capacity to respond to the increased number of cases that may come. So one aspect was the retrofitting of our old Victoria Hospital into a respiratory hospital. It's 80% completed and 85 room capacity. And it's made to specification for dealing with respiratory illnesses, and this was funded by the World Bank. Also, an increase in the number of our ventilators, which we continue to do. And also, we presently have a total of 355 room capacity for quarantine. The next slide, please. Some of the vulnerabilities that we anticipate was the fact that in St. Lucia, we don't produce PPEs. And what we have been doing in our preparation is ensuring that we have a 60-day supply of PPEs at any one point. But one of the mitigation measures is the fact that there is a stockpile through PAHO for if in case countries were to get a ridiculous outbreak and needed support. Testing capacity, which remains an issue for most countries. We have developed PCR testing capacity in country, and we also utilize CAFA when our numbers are excessive and we need those results in a short period of time. CAFA has been very supportive in assisting us in ensuring we can produce those results within a 24-hour period. Capacity at our quarantine facilities, which we are seeing now with 1 week of opening. We have had to look at a number of measures for that, even looking at a 7-day facility quarantine, 7-day home quarantine as the numbers increase. What we do, we test again on the 7th day, and we allow an extra 7 day as well. But we've also put in a model where persons apply before coming down for quarantine. But this has had its disadvantages where within a very short period of time, persons book and fill out to come, as happened yesterday. So we ended up with more persons than we planned for. We also see the potential for excessive pressure on our 85 room capacity at the respiratory hospital. And to do that, for cases that are milder, we would isolate at another public health facility and leave the respiratory hospital only for severe cases, if that were to happen. Next slide, please. Next slide. In terms of the national strategic approach, the Ministry of Health, Tourism, and Office of the Prime Minister, we presented a strategic approach to the reopening of the country in a phased approach from 1 to 5. And each phase, some phases have more than one cycles. And each phase, between each phase, there's a 14-day window to allow us to assess what's happening. As we note, as you move from one phase to the other, the level of risk increases. So the 14 days give us an opportunity to assess, to ensure that we are not increasing cases before we advise and move on to the final phase. Within phase 4, this is when practically every part of the country is open, with exceptions for mass crowd events. We've also removed the curfew, and most of the country is functioning. With the opening of the border, which is being done in a phase, tourism is being done in a phased approach at this point. The next slide, please. Go ahead. Next slide. In terms of regulating tourism, from the national shutdown, we've been looking at the plan towards the safe reopening of the borders. Presently, we've established a public health facility at our international airport that allows for screening and testing of everyone coming in before they actually get into the main airport facility. Physical distancing has been put in, the plexiglass barriers. We are doing the thermal scanning as well. Hand sanitizing, sneeze guards, all the necessary has been put in at the ports to allow screening of persons coming in. We also put colored bands based on where persons are going and also what their status is in terms after the assessment is done. The next slide. We've put together a Caribbean travel bubble. We looked at the number of cases and spread across the region, and the countries within that zone have been allowed to come to St. Lucia without the PCR test and without the necessity for quarantine. And this is something that we are reviewing constantly. I note some of the feedback from the Minister of Grenada and some of the issues that we have with implementation. For the bubble countries, it's really a 14 that you've been within the country for 14 days or more without symptoms. And in terms of implementation, we are aware that there are some issues in ensuring that those persons are not nationals coming from high-risk places, but they've actually been in those countries for more than 14 days without any signs or symptoms of disease. The other issue that we've noted with the bubble, there are some countries in an effort to get to St. Lucia, they need to go through an area of high risk. So those are some of the things that we have flagged, and we also know that regular review and updates has to be done because this changes in terms of the number of cases noted per week. Next slide, please. I think I explained some of the benefits for the Caribbean residents, and this is really because we know that a lot of the countries in the region, the burden of disease is low or is similar to us. So it would exempt you from the pre-PCR testing requirement that other countries have to fulfill. And like I indicated earlier, it's the recent travel from those countries which we are looking at and not nationality. Everybody gets screened. Anyone who's symptomatic or deemed to be of high risk would be tested on arrival as well. The next slide. This just gives a snapshot of the process for returning nationals outside of the travel bubble and what they're allowed. I will allow the Permanent Secretary of Tourism to present the next few slides.
Good morning, everybody. Adopting the protocol established. My name is Donaldin Vite, Permanent Secretary in the Ministry of Tourism, Information Broadcasting, Culture and Creative Industries. What we have instituted to facilitate travel and prior information to health, immigration, and other agencies for coming in is a pre-travel registration form. This is a temporary measure. We are going into instituting and utilizing a more holistic one-time solution, an web-based application that will be able to support approvals for persons coming into St. Lucia via the registration, approvals for home quarantine, as well as to take immigration information, which would mean for us that we would not be using the paper entry form for immigration, which normally exists. So this solution provides the opportunity as well for use as a tracking device, especially for returning nationals who will be going to home quarantine. Dr. Belma indicated that we might be reaching thresholds for our quarantine capacity due to returning national volumes. And so we want to ensure that there is a level of compliance and knowledge of space in terms of where persons are supposed to be, and they confine themselves to the quarantine protocol. So it has some sort of tracking via a cell phone, as well as we are moving to go into the use of some bracelets and watches to assist with tracking devices and alerts to the medical and police teams. So the way we have gone around it is that the returning national will communicate their intention to return home or travel to St. Lucia. There is a pre-entry registration form that is reviewed by the Ministry of Health with a small committee. The formal correspondence is issued to the individual, and the information or assignment of quarantine method, whether it is state quarantine or if it is home quarantine, then the information will be made known to the client or the person wishing to travel to St. Lucia. The returning national will then book a flight with the airline of choice, but they must adhere to the protocol that a test taken prior to travel is valid within 7 days. We must say that we have had quite a few flights since our official reopening on 9 July. I think most persons on the call, especially the ministers, would have participated in rounds of communication led by our Prime Minister, where St. Lucia indicated that it did for reopening would have been the 4th of June. We have had some setbacks since the 4th of June, and so we have had to reset our opening to 9th of July last week, Thursday. So we have the cooperation of the airlines, and so far, all persons who are coming into St. Lucia have been mandated to present evidence of their negative test taken within 7 days of travel. Just moving along that journey, returning national would adhere to the airline protocol or the airport protocol, if any, during the flight journey. The returning national will also adhere to the protocols as established on the airports as well as seaports, because for us, yachting has also resumed. We have 3 official ports of entry for yachting. 2 of them are our formal ports, and these 2 formal ones have reopened, and they are taking traffic from the bubble that Dr. Belma explained. The returning national, of course, will be screened. There are 2 levels of screening at the airport. One is a detailed one in a public health facility, and the other one is via a mass fever scanner that persons with elevated skin temperature will be flagged and pulled out by public health as they proceed to immigration, customs, and baggage. The returning national will await their assigned transportation. So what we have also done is, looking at the phase reopening for tourism, we, via policy, established 3 phases. So in phase 1, we have the most critical or essential services to actually commence tourism, and by that we refer to accommodation, transportation. We have added in phase 1 limited activity, which is just water-based activity. So we have 3 key areas within the industry that's open in phase 1. It is the principle for that is that we do not want to overwhelm the system. We anticipate that we will get cases, and so in anticipation of that, we are restricting the movement of visitors to only organized activities. With the alternative accommodation sector, what persons normally refer to now as the branded language of Airbnb, this segment of the accommodation sector has not reopened to persons coming from high-risk regions. However, they are open to staycation as well as what we consider to be bubblecation at that time, because we want to ensure that there is a level of equity and inclusiveness in the reopening.
Next slide.
Next slide, please. Dr. Delma.
Okay, this just gives a summary of our established quarantine protocols for nationals that are returning outside of the Caribbean travel bubble. Our gold standard for quarantine is facility-based quarantine, especially for persons coming from the high-risk areas, close contacts of possible cases, persons who may have had a rapid test, or those whose homes don't meet the criteria for home quarantine. However, we've had to make considerations to allow home quarantine for minors coming in, persons with underlying medical conditions or disabilities, and persons coming in from lower risk areas as well, and those whose homes meet the criteria for home quarantine. We've also looked at the 7-day model where we keep 7 days within our institutional quarantine, test after 7 days, and allow for the other 7 days home quarantine. And this measure is done because of deficiencies in the number of quarantine spaces that we have available at this time. Next slide, please. For the yachting sector,
so for reopening the yachting sector, like we mentioned just a little while ago, we had to take a multi-sectoral approach, and we looked at local yachting activities for yachting within the bubble, as well as what it would mean for persons coming out of the bubble into our ports of entry. Those coming into our ports from areas of more high risk, they're required to quarantine either at an approved hotel. It sounds a little weird, but the sort of stay we have right now in St. Lucia for tourism and the protocols that the hotels have had to adopt are very, very stringent. Some of them include that hotels would have had to institute a medical facility at the hotel. They would have had to have at least three shifts of a medical practitioner full-time, and for the final shift, which is the 4th one, they could have a doctor on call. So we are satisfied that based on the conditions established at the hotel, that instead of allowing that yachts person to put more pressures on our government-operated quarantine facility, that they can or should be allowed to pay their stay at a hotel and ride out that 14 days, and after which they could now be tested and screened, and they could resume their normal activity. We have a high incidence of persons who were wishing to come to St. Lucia because their vessels were already in port. St. Lucia is used as a safe haven for some of the vessels with relation to the insurance for the vessels. So we have had a high traffic of demand, and so we looked at 2 ways in which we could support that. One for the bubble, and the other persons coming from regions of high risk, which we treat very, very similarly to persons coming from high risk via the airside.
Next slide, please.
So in terms of the path, we looked at for contact tracing efforts and strengthening the capacity. We had mentioned that we were looking at an app. Persons probably, there's a lot going on social media. I know that Jamaica has instituted that app, and it is the same company who, the same license company that we have engaged, and we have started and put the moves in motion, and we should be launching that app which will transition the temporary measure we have right now. So hopefully next week this would be installed. So persons wishing to come to St. Lucia, whether national or non-national, would have to download the app. It will also be used to provide alerts to individuals based on confirmed cases, as well as to the Ministry of Health, that these may be persons of interest, and to assist in contact tracing. Logs will be generated from the app and sent directly to the Ministry of Health. Also, there's a requirement for all participating hotels that from the records of the daily screening of visitors would be sent to the EPI department. It will also assist us in enhancing our contact tracing and to be able to capture any patterns and to look at irregularities and to institute measures when necessary. Next slide, please. This has also been supported by legislation. All of the controls and the phased approach we have for tourism, the restrictions of movement, have been supported by legislation under our emergency powers by our AG's chambers. Dr. Belma will take us through this slide.
Okay, this just gives an idea of the travel protocols. I think most of them we've gone through it. For those within the bubble, the international travel, the need for the test before coming and the screening, and for our returning nationals in terms of the home quarantine or the state quarantine. So we can move on.
So because of the vulnerabilities that exist with the alternative accommodation sector, what is a matter of fact is that this sector has grown on St. Lucia by leaps and bounds over the past years, in particularly the last 3 years. We have not been able to have a firm grasp on it, but COVID, like the other ministers have announced, have presented significant benefits to us, or opportunities rather. And one of the opportunities that we're taking advantage of is to have a proper registry and details of all properties under that sort of what we consider the informal sector in St. Lucia. So we have started a process of registration. We have developed protocols for them. We are doing site inspections at every property. It is very important not only from a public health perspective, but from an immigration and safety perspective. It's of good interest to our Department of Home Security. Sometimes you have persons coming into St. Lucia and they put very questionable or weird or unfamiliar descriptors in terms of their location or the name of the property that we don't have on our docket. So that provides an opportunity for us to familiarize ourselves and to know what the details of the accommodation is. We have been providing training for the entire sector in a phased approach according to the reopening. So we have been supported by PAHO, CAFA, as well as the HR from Ministry of Health and particularly Environmental Health Department. To be able to support our inspections and training, we have hired a cohort to supplement the existing staff, and they're really dedicated for tourism because of the size of an expanse of our industry. We have instituted a level of certification. So all properties that have reopened in the first phase and for the phases to come would have received a prior certification that would denote that they can open or establish their operations. These properties are listed on the ministry's website and have a direct link to immigration. So there's a lot of fact checking and cross checking if it is somebody's able to slip for the crack, being able to register pre-travel, not having a COVID certified property and land in St. Lucia. Anybody not having a COVID certified property or a confirmed booking, and that can be fact checked, is immediately passed on to a government quarantine facility. They may choose to return to their home country thereafter, or to commence their normal vacation after that time. And there's a level of verification that is associated with this as well. So while it is that we have the COVID certified properties more for the formal accommodation sector in phase 1, we have commenced the process of registration and to allow a semblance of activity, by doing our staycations, promoting staycations, as well as bubblecation for the informal accommodation sector. Next slide, please. So Dr. Belma will go through what we consider to be some of the triggers in the system since we reopen tourism as what might be of interest to the ministry. If it is we need to revert, or if it is that we are getting very good reports and very good results and we decide to move forward.
We strengthen our surveillance system in terms of monitoring for community transmission and also within our quarantine sites and also within the tourism sector. So we have screening happening at all of those areas, and we are also looking at the country's capacity and where we are in relation to that. So these are just some of the things that we are monitoring to ensure that we can move forward on a daily basis.
Right. So hotels, for example, accommodation are not allowed to operate, and it is buttressed by law if they do not have a COVID compliance certificate issued by the Ministry of Health. Any failure by the hotel to adhere to the license conditions as well as any protocols established by the Ministry of Health will indicate a level of revocation of the property to operate. We are also monitoring breach in terms of our border control. There are some aspects of our borders on the seaside that have a level of porosity. And so police and marine police are constantly monitoring those areas. Although we have reopened, it's a week and 1 day now, we have had some challenges. It has not been as glossy as we would have liked it to be. We have had breaches on 3 instances with visitors leaving property. We have had to arrest the situation. The hotels have been able to provide evidence to us of the sign up for the arrival of the guests, the information that goes out to them, even our St. Lucia Tourism Authority, in terms of the pre-education that goes to travel and trade. They have an extensive orientation on what our protocols are in St. Lucia and what the expectations in country are. We also have been able to, or had reason to involve the police in the areas of those breaches, but generally, based on the population of visitors we've had for the first week, we have general compliance of the visitors. Where is a little bit more testy is in our returning nationals who have been assigned for home quarantine. We have had some serious tests of the Ministry of Health and of the police, and the police have become very, very firm. And it's one of the reasons why we are going to be instituting the tracking device via the bracelets and the wristwatches in the coming week. Next slide, please. So in terms of moving forward as a resilient state or finding our new normal, there has been, we mentioned, there has been very heavy training going on, and really what is constituting to be almost as a behavioral change or cultural shift, a paradigm shift for the entire sector, and I mean normal St. Lucian way of life. We are continuing to work on the completion of our respiratory hospital to facilitate a higher number of patients in isolation, and that will be completed by August 2020. Notwithstanding, there are a couple of rooms within this facility that are actually ready for use. We have procured a minimum of 4 additional ventilators, which will allow St. Lucia to meet a per capita requirement. So our current capacity of ventilators is 20. We have 6 of them that are in transit, and they should be on country by the end of July. And we have a commitment by UNOPS for another 2, and a commitment by the World Bank for 4. So by the end of August, we're anticipating that our stock of ventilators will be 32. We have increased our capacity for testing to include a wider cross-section, and we test in frontline workers, particularly those who work at the borders and since the country is open. So Dr. Belma will speak a little to increase testing capacity?
Yes, we have been constantly procuring equipment. I'll be very brief to ensure that as our numbers increase, because as you note, we're in the first phase of tourism opening. Before we could move to broaden that phase, the country's capacity to manage a greater number inflow of passengers would have to be strengthened. Next slide, please.
So this for us is really finding our new normal and ensuring adherence to health and safety protocols to move steadily through phase 5. So we are in phase 1 when it comes to our tourism reopening, and we are taking this phase very, very seriously, because it's going to be really critical for us to get it right up front, so that we could move, to our normal way of life. The tourism sector, the hotels and tourism, it continues to be reopened. And what we have been doing in the reopening is adding services gradually. And so what is currently available at the hotel mimics some of the services that are available domestically. So the spas are allowed to operate, the beauty clinics, the boutiques, right? And we're really trying to move to the phase where we can at least be fully open. Right now, we have one imported case, but this person is in quarantine. Thank you.
Thank you very much. I think we'll end here.
Okay, thank you, Dr. Belma Joyce, CMO and team. All right, two additional questions that there are two additional questions that came in to me earlier, and one of those questions related to, I think, was directed at the ministers of health generally, and it asked that as policymakers on the front line of this pandemic, what are some of the challenges that you have experienced in making public health policies, and what key data you require to inform your policies to create that needed balance between public health response and economic protection and progression? That was one. The other question is related to testing. We know that there's frequent intra-island travel, both short in duration and frequent and high in frequency. And given that countries already have limitations with testing, how do you overcome the challenge of having to test for both persons on arrival as persons who are departing to go to other countries that require them to be tested negative, as well as testing based on your in-country protocol for suspected cases and those in quarantine? Those are two questions that came up. So I'm open to questions for any of the panelists who would like to answer.
Dr. Ewan had dropped off for a while. Is it possible for you to repeat the question?
Yeah, maybe the last one will be specific for you, Honorable Steele, because this one is talking about, they asked a question about testing capacity, knowing that we have lots of limitations of testing already from the start of the beginning of the pandemic. And with countries now having to require persons to have a negative test, PCR, before entering, and some countries actually testing upon arrival, as well as countries and persons leaving a particular country having to have a test in that country before they move to another country. Do we have enough testing capacity in the countries to meet all of those testing needs and requirements?
Well, I think, yes, that is a very valid and important question. And in my opinion, any of us must have the capacity to test in a day the throughput that we may have at our airport in that date. As a worst case scenario, or at least within that 24-hour period in 2 or 3 batches of PCR testing. That is essential for contact tracing, etc. So with the new consideration as well that we would have to do PCR tests for individuals departing, which was something that we always held as a possibility. In Canada, we do have that capacity when you combine both the public lab facilities as well as private lab facilities. There is one private institution here in Canada that is also offering PCR testing. In essence, unless we have capacity strain, our lab will do for those who want to leave at a charge. Those who are coming in, there are conditions, the face test is already completed for the additional test comes at a fee. So we have the capability there for that, but that is based on the current load of passengers coming and going, the tourists and visitors coming and going. As if we have to contemplate an increase in tourism trade, then we have to contemplate ramping up that capacity as we move forward, assuming that we will have to maintain the criteria for quite some time.
Okay. All right. Thank you for that answer. And the other question really was, I think, speaking generally to ministers and policymakers, the Minister of Tourism and Ministers of Finance, given the hard decisions you have to make in trying to balance public health policies versus economic policies, and how do you think we had enough information at hand to allow us to make those policy decisions, data, scientific data, otherwise, to make those policy decisions? And how do you think we could address that going forward?
Someone else wants to take a jab at that, but I think that has been the most difficult for us as health ministers. Fortunately or unfortunately, I am also in the international business, so responsible for the investment into data. That has been key in finding the balance between the hat that you wear as a Minister of Health, where truly if you are wearing that hat, you want to keep your body closed, you want to keep your body safe, and have the risk as low as possible, if not at zero. But you have bills to pay, your population needs to eat, healthcare costs money, so you have to move forward, and you have to find a new law, and therefore you have to find that area where it is the least risk, give the risk as best as possible, and you find that balance. Each and every one of us has found a slightly different balance with respect to timing, etc. But we find that the minimum level of safety has been maintained throughout all of our countries, and I think we're all comfortable with the standards that each and every one has maintained or gravitated to, because for all of us it's been a learning process. And once as governments we are able to self-address self-care as quickly as possible, because like I said, there is no book. So the biggest challenge has been finding that balance. Jury's still out on that, because most of us, if not all of us, are just open to take for a month or so, or to open. And also, I think the risk situation keeps changing globally. Regrettably, we see our major
Okay. Okay, thank you, Honorable Steeler. Minister Joseph, yes, I just want to call on you to give me your views on those questions. And
yes, I was waiting to hear my good friend Nicholas handle that one. It really comes down to balance and realization that when you look at the long-term future of our states and our people, you have to err on the side of good health. And so you have to establish the priority in these difficult times that with your limited resources, you cannot allow your health sector to falter. Not only are we fighting COVID, we're also fighting NCDs. And we have to keep our eyes on that. As it turned out, most of the casualties of COVID, the fatal casualties, are individuals with underlying health conditions, and most of that is non-communicable diseases. So from time to time, when the Ministry of Health and the Ministry of Finance have to interact, the case has always been that the health of the nation must take priority. What that means sometimes is how you sequence your development. Sometimes you have to forego with some of your projects at this time. And the most difficult thing we have to face as not only Minister ministers of finance as well, is that this COVID is so unknown, you really cannot charter a definitive course on how you're going to negotiate this COVID. And we've had from time to time laid out programs only to find that you have to change your programs because different scenarios come up. And so that there has to be, as my colleague said, a sense of balance and flexibility. I would just add flexibility to ensure that your health system and the health of the people in the nation remains the top priority.
Thank you for those words of wisdom, Minister Joseph. Thank you very much. And thank you very much, participants. I will now call on Dr. Yetadis Gibre, PWR, to say any closing remarks and to close the session when he finishes. Dr. Gibre.
Okay, thank you so much. Honorable Ministers, Your Excellencies, Permanent Secretaries, CMOs, and colleagues, it is abundantly clear that life, health, and well-being are essential and prerequisites to reactivate the economy. Hence, it is critical that evidence-based measures form the basis for promoting health and economic reactivation. This afternoon, actually, we started in the morning. We discussed about the reopening of borders, reopening of non-essential travel. It needs a delicate balance. It is not how early to open, but how safe to open, to consider the best national interest and then people-centered. Following science, public health authorities advise to fight COVID with confidence and consultation with the wider community. We also discussed that the Caribbean travel bubble and the issues of inclusiveness, transit passengers, international travel, returning passengers, having a clear protocol which is shared to all to improve infrastructure and capacity, including respiratory hospitals, to assess risks and then creating risk assessment zone, to have a pre-travel registration system for web-based applications, to quarantine, isolate how it is done, home or facility, tracking systems, geofencing, contact tracers, increasing the numbers, including to restricting or the use of alternative approaches, staycation, bubblecation. There are so many new terminologies also we learned. The use of applications for contact tracing, alerts, COVID certification of accommodations, strengthening the health system above all. I thank you, ministers. I thank you all for participation and sharing your experiences. We'll put this in a report and then submit to you for your understanding and then use in for future. Thank you very much. Have a wonderful weekend and have a wonderful afternoon. Thank you all from the PAHO country office here who has supported us, Dr. Ewing, Dr. Karen Paulson, Ms. Brenda Lashley, Ms. Donalisa Peña, Ms. Beatrice McCarthy, Ms. Carol Coppins, and all the media houses who are also with us this afternoon. Thank you very much.
Thank you. Thank you. Good evening.